and thank you for coming to the Healthcare Providers and WiC Providing Better Nutrition for Brighter Futures webinar. Appreciate you taking time out of your day and or your lunch break to join us. Before we get started, just wanted to give a little bit of background on myself. My name is Lauren Hosterman. I am a registered dietitian and nutrition specialist with the Maryland WiC program. I have worked for the WiC program for a little over 8 years, almost 8.5, and I spent the first 6 years of my time at WiC working in a local agency, so working as a dietitian in the clinic. And then over the last 3 years, I have been working at the state WiC office, so kind of overseeing the policies and MedDoc forms. So I've gotten to see both sides, working in the agency clinic and then also working at the state level. So we'll go ahead and get started. Okay, so to briefly go over the agenda for today and what I'd like to cover, which is a lot, the origins, history, and WiC program basics. So we can get an idea of the WiC program and how it operates, as well as WiC program legislation, foods, provision of formula for infants, so the process and policies for issuing formula for infants through Maryland WiC, the Maryland WiC medical documentation form, provision of WiC eligible nutritionals, which some will think of as nutritional supplements or medical foods to women and children, and then at the end, DHMH, the Department of Health and Mental Hygiene, has a couple slides that they've asked us to share for public webinars on the Zika virus. Okay, and so my objectives of this webinar are to provide a brief overview of the WiC program, including the origins and benefits, summarize WiC federal state policy and procedure development to familiarize healthcare providers with the regulation process, to discuss Maryland WiC policy and procedures 3.02, which is our policy on issuing infant formulas, and 3.03, which is our policy on issuing WiC eligible nutritionals to children and women, and of course the medical documentation form. And lastly, my hope is to facilitate a method for communication between the Maryland WiC program and healthcare providers to help streamline the medical documentation process, which I think we'd all appreciate being able to do. Okay, so to give you a little bit of background, WiC started, it actually just celebrated very recently its 40th anniversary. And the WiC program, which originally started to treat malnutrition and underweight. And in this picture here, you can see there was a visit by congressmen over the Mississippi Delta to see kind of how poverty was and how people were actually malnourished. And the WiC program kind of stemmed from that. And this is an original quote from the USDA Secretary Mike Espy. Others have questioned if hunger exists in our country. I can tell you that hunger does exist in this country. For many adults and children, going to sleep hungry is not a threat, it's a regular occurrence, and it must end. The WiC program has made great strides, and we have helped, but we have new challenges today, and now people can still be malnourished, but also be overweight or obese. Okay, so just some brief background again. It was started in 1972 as a pilot program called the Special Supplemental Food Program, and in 1975 it was established as a permanent national program, and so that's why we just celebrated the 40th anniversary. The program is up for reauthorization every 5 years, which means every 5 years they review the Act, Child Nutrition Act of 1966 and its amendment, and decide if the program is going to be funded for another 5 years. So for 2015, we are still waiting on reauthorization. The bill is marked up, but Congress is out for 6 weeks for now. It might be 5 now. So we're waiting on that. But however, every year it is up for the amount of funding varies from year to year. So what makes, which many don't realize is WiC isn't an entitlement program. For example, medical assistance or Medicaid, Medicare, the food stamp program or SNAP, they're entitlement programs. So Congress has to set aside the amount of money for the amount of people that are eligible. For WiC, that is not the case. Funding is not guaranteed from year to year, and the amount of funding is not guaranteed. So there is instances where we have more people that are eligible than funds that we have to serve them. So that's something that's been more tricky recently than it has in the past. So it's a federal grant program, and it's administered at the federal level by the United States Department of Agriculture, the USDA, and the section Food and Nutrition Services, or F&S. And it's administered by 90 state agencies. That includes all states, DC, 34 Indian tribal organizations, and 5 territories. And there's also some on military bases as well overseas. Okay, so I'm not going to go review this chart, but this does give you an idea of where do the WiC foods come from. There is some local state flexibility on what foods the WiC program offers, but it's really set up at the federal level. And every 10 years, the Institute of Medicine, or the IOM, is charged with reviewing the WiC food packages and making recommendation to the USDA's F&S, or Food and Nutrition Services. They review the recommendation and revise the Federal Register, which is publicly available. Probably the easiest way is to Google it, Federal Register 7 CFR. These are all parts of the way are open for public comment, but there is, Congress does have the authority to change any of the provisions, which recently came about with adding potatoes, white potatoes to the WiC food package, allowing those. But this is an idea where the actual foods come from, and the IOM makes sure that we're targeting nutrients that are of concern of low-income women, infants, and children, and lacking in the diet, and based on evidence. Okay, so then when it comes to Maryland, state WiC programs have to interpret the federal regulations and create our own policies and procedures. So we do have some flexibility on being more stringent, but not necessarily more, we can't be more lenient. F&S must review and accept the state WiC program policies and procedures before it's implemented. And then these are also incorporated into Maryland regulations, which is known as COMAR, the Code of Maryland Regulations. And then state WiC staff is charged with disseminating the information to the 300 WiC staff members we have at 18 different local agencies. So it's quite a process getting to the point of where we are here now. And just to make sure to drive home the point on how important the WiC program is, it is found to be it's really a huge public health, maternal child health success story. It is very cost effective. I always love this button here that says WiC is a deficit reduction strategy that works, because research has shown time and time again that WiC does save money. For example, every dollar spent on prenatal WiC participation saves anywhere from $1.77 to $3.13 in Medicaid costs, likely due to the reduction in low birth weight, prematurity, and other birth complications. And then there's also taxpayer savings. Every dollar spent on WiC benefits returns $3.50 over, really, a child's lifetime in present value to federal, state, local, and private payers. Okay. And it's also associated with a lot of positive both health outcomes and also increased use of medical care. Some improved health outcomes include better birth outcomes like decreased risk of low birth weight, preterm birth, infant mortality, improved diet and diet-related outcomes, infant feeding practices, increasing the rates of breastfeeding within the WiC population, immunization rates. Studies have also found improved cognitive development when children participate, and preconception nutrition status. Also associated with an increased use of regular dental care. So agencies now have hygienists that come right into clinic and do fluoride treatments and kind of the need-to-need check of infant's mouth or child's mouth. Hearing screening, that's a study that just came out recently in pediatrics. Routine preventative care, well child visits, and prenatal care visits. Okay. And recently, sort of recently, in 2009, the WiC program released new food packages. And this is where we added a bunch of new foods. They hadn't been changed prior for 30 years, so this was a great chance for us to meet kind of the new challenges of the WiC population. And so studies have found, a recent big one that came out was that it has increased the consumption of healthy WiC foods in WiC participants, including non or low-fat milk, fresh produce, which participants can buy with their checks, and whole grains. And a benefit really not just to WiC participants, but the community, and with all the food deserts that we have in both suburban, urban, and rural areas, is increase the availability of healthy foods, which all the WiC foods are, and especially in your mom and pop type stores, such as ones with 1 or 2 cash registers. And also improve breastfeeding rates. There has been new food packages developed to also support breastfeeding moms and they've found it increased exclusive breastfeeding initiation, duration, and an associated decrease in formula supplementation. So all really, really good things. And this chart here shows the red line there, the vertical red line shows when the new food packages were introduced. And you can see exclusive breastfeeding climbed up, and you can also see combo feeding decreased, so formula and breastfeeding, and formula only slightly decreased as well. Okay, so basically to be eligible for the WiC program, someone has to be a woman, infant, or child. So pregnant, breastfeeding, and a non-breastfeeding postpartum woman. This also includes women that may have miscarried, and infants and children up to their 5th birthday. They have to live in the area of the local agency they apply to. So if they live in Howard County, they have to participate in the Howard County WiC program. Income up to 185% of the poverty level, which includes adjunctive eligibility. So documented participation in Medicaid, or in Maryland this would be MCHIP or medical assistance, SNAP, which is the food stamp program, or TANF, which is temporary assistance for needy families. In Maryland it's referred to as temporary cash assistance. And then all participants have to have a nutritional risk. These can be medical, such as cystic fibrosis, or they can be diet-based, such as inability, adding complementary foods too early. Okay, and then the WiC program, there's a focus on the food benefits that we provide or formula, but we do so much more than that. So we provide nutrition education that's required to receive benefits, so that's done in clinic, through the phone, also breastfeeding education and support. We provide only certain foods, so selected supplemental foods that target key nutrients, and then of course health referrals in a caring, supportive environment. Okay, and the participation in the WiC program is extensive. We serve 53% of all infants in the U.S., a quarter of children aged 1 to 4, and the last data that we have here, about 8 million participants in federal fiscal year of 2015. In Maryland specifically, 143,000 Marylanders receive benefits each month. This helps the community again because it brings business to 1,350 authorized WiC vendors, and they can receive services through 18 local agencies and 87 clinic sites. Okay, and as I mentioned, we're here to meet sort of the new challenges of the WiC population, and child poverty is still a huge issue. It just looks different than it did when WiC was originally started. Obesity is highly related to food insecurity, and you can see here that this actually shows from 1959 to 2014 that child poverty rates have actually exceeded what used to be considered older Americans, so age 65 and older, their poverty rates, and those that are of adult age as well. So 21.1%. So about 1 in 5 children live in poverty. And also we have, we're pretty low on the list, as you can see on this breastfeeding policy scorecard for developed countries. We have a rating of poor in terms of our breastfeeding policies, and Maryland in particular has been working very hard on improving the breastfeeding policies with the introduction of more breastfeeding friendly hospitals and also some other policies in terms of pumps and the ACA. So working very hard, but we do have challenges in terms of increasing how we support moms that are breastfeeding. And another challenge, but also very exciting, is WiC is moving from paper checks to what's called an EBT card. And in Maryland, we're calling it eWiC. And this is, participants are going to be able to go to the store and use a card, like a debit or credit card, to purchase their WiC foods in place of the WiC checks. And this does give a lot more flexibility in terms of how much a participant can get at one time, or also in terms of what their experience at the cash register as well. So very exciting. Starting in 2017, that'll be coming. Okay, so now I'm going to focus on the Maryland WiC foods, so the foods that we give in Maryland. And I mentioned that we give specific foods, and our priority nutrients for WiC are what we're targeting with the specific foods. And here you can see iron, folic acid, zinc, magnesium, potassium, vitamin E, but all why we want to prevent excessive saturated fat, total fat, calories, and sodium. So healthy foods. This gives you an idea of the foods that WiC does provide for different categories of participants. Now this is women and children specifically. This is actually on the back of the medical documentation form, which I know when it gets faxed and copied, this part usually doesn't make it on, but this is there for your reference. If you also go to our website, you will see both sides are present on our website. And this just gives an idea of the type of foods that we provide on a standard food package. Milk, cheese, milk can be replaced with soy beverage, lactose-reduced milk, lactose-free, cheese, which may be substituted with tofu, eggs, beans or peanut butter, cereal, whole wheat bread, brown rice, or whole wheat or soft corn tortillas, a vegetable and fruit benefit where participants can buy fresh, frozen, or canned fruits and vegetables. And with this, they do have the opportunity to buy organic, fruit juice, and canned fish, which we do give to exclusively breastfeeding women only. And then WiC eligible nutritionals, which are the special formulas intended for children and women. Okay, and the basic distinction between the food package or the foods that we provide for children is at age 1, whole milk is the standard milk that we provide. We do not give peanut butter, and soy beverage and or tofu or 2% milk may replace whole milk or cheese with a nutritionist approval. 2% milk is in the cases where we're looking, maybe a child is at risk of overweight or obese, or maybe the family has a history of high cholesterol and there's concerns about that. But the nutritionist, which you'll also hear me refer to that throughout this presentation as a CPA, can make the approval to offer that instead. At age 2 to 4, we do offer 1% or fat-free milk as a standard. They do have the option of peanut butter instead of beans. And same thing as before, soy beverage and or tofu may replace milk or cheese with the nutritional approval. And whole milk may be provided with medical documentation for children that meet the qualifications with nutritionist approval, but we do need documentation for that. Okay. Infant foods, for breastfeeding exclusive infants, they are provided, they're getting mother's milk for the first 6 months and do not need anything else. The mother is getting Grand Deluxe or a lot more food in her food package, and she is providing the sole nutrition to the infant. So this includes infant cereal, baby fruits and vegetables, and infant meat that are issued at 6 months of age. Infant that is being breastfed mostly, so they're getting less than 14 ounces of formula a day, are provided the formula that they're consuming up to the amount of 14 ounces, and infant cereal, and they get baby fruits and vegetables, but less than the exclusively breastfed infant. And an infant that's being breastfed so receiving more than 14 ounces of formula a day, or not at all, are provided the amount of formula they're consuming up to the maximum. If it's tailored to the amount of breastfeeding, if they're not being breastfed at all, they only get up to a certain amount. And then infant cereal and less baby fruits and vegetables than the exclusive breastfed infant. Okay. So I'm going to dive into formula here, but I do want to emphasize that mothers participating in WiC are strongly encouraged to breastfeed their infants. It's emphasized and reinforced through an active and extensive education and peer counseling program. And the peer counseling program is former or current WiC mothers that breastfed their children there to help other mothers. And it's been an extremely successful program. WiC breastfeeding initiation rates in Maryland have increased from 13% in 1991 to 69% in 2015. So leaps and bounds in terms of breastfeeding in the WiC population. Okay, and by the way, today is August 1st, so it is the first day of World Breastfeeding Month, and happy World Breastfeeding Month. And today, this year's theme is a key to sustainable health. For those of you who are interested in international health and the MDPs, this has correlates with that. Okay, so I'm going to be reviewing Local Agency Policy and Procedure 3.02, and I'm referring to these by their specific policy numbers because these will be posted, these actual policies will be posted on our website for your review, and as well as this presentation and the slides will be used too. But this is a policy on provision of formula for infants. Okay. As I mentioned, we strongly encourage moms to breastfeed, but we do provide formula to mothers who choose to use it, and we can provide, as most of you are aware, special infant formulas and certain medical foods, which WiC calls WiC eligible nutritionals, when prescribed by a physician or health professional for a specific medical condition. So I just wanted to go, there's some terms I'm going to keep repeating throughout this presentation, and I wanted to review those. But first I wanted to mention that formula names are used throughout this presentation for examples only, and they're not intended to be an endorsement of any particular product by the Maryland WiC program. They're used as examples. So infant formula we'll be using, that is how the FDA, so the Food and Drug Administration, defines infant formula. Contract formula, which would be the formula that we get a special contract price for it, and that's our exclusive provider of milk and a soy-based formula. Non-contract formula would be a comparator product that would be another brand that is also considered a milk or soy-based. And special formulas are a class of formulas that require medical documentation from a healthcare provider with prescriptive authority. And you can see down here we have the definition as a practitioner with prescriptive authority, such as a physician, certified nurse practitioner, certified nurse midwife, or physician's assistant. And that encompasses our special issue contract infant formula, exempt infant formula, and WiC eligible nutritionals. And food package 3 is our food package reserved for infants women, infants, or children with special medical needs that require a package different from our standard food package. So different foods than we would provide necessarily to a child that doesn't have any medical issues. Another term is a CPA, and that's kind of WiC's own term. As with any government program, we have a lot of acronyms, but a CPA is our WiC nutritionist, and you'll hear that throughout the presentation as well. Okay, so by law, by federal law, all state agencies are required to competitively bid infant formula rebate contracts with infant formula manufacturers. So depending on, we could have a contract with two different actual companies. You can have one and the same, but we do have to go out and bid, and each state is required to do that. And we'll provide one brand of infant formula to participants who do not require a medically prescribed formula. In return, we receive a rebate from the manufacturer for each can of infant formula that is purchased by WiC participants. We pay the lowest possible price for the formula, the contract formulas, and the brand of infant formula provided by WiC varies from state to state, depending on which company has the rebate contract in a particular state. And realize this can be difficult for parents, you know, right here where we're in Maryland, DC, Virginia, Pennsylvania are all close, West Virginia. Someone might move from a different state and the contract formula is different in WiC, but it is required by law that we do that. And it allows us the benefit, another benefit of the infant formula rebate system is it allows us to serve more participants. The amount of money that's saved on infant formula is used to provide benefits to more applicants of the WiC program. And in Maryland, that is over 30,000 more women, infant, or children. Okay, so our formulas have to meet the definition of an infant formula, which was defined by the FDA in 1980, revised slightly in 86. So it has to be 20 calories per ounce and have 10 milligrams of iron per liter. The forms, powder, liquid concentrate, which is mixed 1-to-1 to create the formula, or ready to feed, which requires no additional water to be added. Okay, WiC does not provide non-contract infant formulas, except in very rare circumstances, and I'll discuss that a little later. Low-calorie infant formulas, less than 20 calories per ounce. Also talk about that a little later. Cow's milk or goat's milk, formula designed for less than 1 month use as per manufacturer's guidelines. We provide benefits, in monthly checks at this point, and so there's no way we can give a partial month's benefits. And then modular products, so these would be things like adding extra protein, straight extra calories, lipids, that don't provide a complete product, complete nutrient product. Okay, so unauthorized infant formula is non-contract. So currently our contract in Maryland is our milk-based product is Similac Advance. Our soy product is Gerber Good Start Soy. So any product that is compared to those that would be considered a standard kind of milk or soy base, we do not provide except for in extremely rare circumstances. So I do have listed here the comparative products that we would not be able to provide for Infamil, Gerber, and Similac products as well. The ones that have an asterisk next to them, there's some of these that we can provide in rare circumstances. And this would have to be, in terms of rare, usually this might be something like an inborn error of metabolism where there's one type of ingredient that's used by one company but not the other that would require that they use a non-contract formula. And of course, to be able to authorize this, we would need medical documentation from a healthcare provider. As a note, if any of you have a patient that requires a non-contract formula, local agency nutritionists are not able to issue them. That has to get state approval. So you can always give us a call, which will have our information at the end of this presentation, to make sure that you have everything set up, because we will provide them if they're needed for the health and safety of the child. Okay. A note about, sometimes I've gotten this question about generic formulas. We do not provide generic or store brand infant formula. And the one point I do want to make about this is WiC is supplemental. And I would say most of our participants find that they have to purchase formula on their own at some point. So it is, provided that they're on kind of a standard milk or soy-based formula, might be a more affordable option if they have to purchase infant formula on their own. Some of them come in bigger sizes, and they're able to purchase that. So something to kind of be aware of and to think about. Okay, so as I mentioned, our contract formulas in Maryland are Similac Advance, Abbott Nutrition. It's a milk protein-based formula. It contains lactose. We can issue it in powder, concentrate. Ready to feed is only in certain circumstances. Now, just as a note, because there is several different versions of Similac Advance out there, WiC provides a 12.4 ounce size, which is 20 calories per ounce. There is other sizes out there for the powder that are the 19 calorie an ounce formulas. So just something to be aware of. The WiC size is the 20 calories per ounce. The concentrate, and then of course ready to feed. For our soy-based, Gerber Good Start Soy from Nestle Nutrition, soy protein-based, it's milk-free and lactose-free. And we also offer it in the powder, concentrate, and ready-to-feed versions. Okay, so special issue contract formulas, this is where we can start thinking of them as our special formulas that require medical documentation. When we are issued, for example, the infant formula contract, we do have sometimes other formulas that are offered from the manufacturer for a special price as well. And so we do not allow the competitors of those products except for some medical documentation. But they're treated just as other specialty formulas. They require a healthcare professional or healthcare provider to fill out the medical documentation forms. And then all these requests are subject to our WiC nutritionist or CPA approval. So it's part of the cost containment contract. But these special issue contract formulas shall only be issued when prescribed by a healthcare professional. And they can only be issued for qualifying medical conditions that are documented. So the special issue contract formulas in Maryland are Similac Sensitive, which is Abbott Nutrition's lactose reduced formula. It still does have a milk protein, so it's not appropriate for those with milk allergies. And then this is the 19 calories an ounce. It comes in powder. The concentrate is not available retail-wise, and then ready to feed. We also can provide with medical documentation and a qualifying condition, Similac Spit Up, which is also milk protein based. It is lactose reduced, just like Similac Sensitive, but rice starch is added so it thickens when it hits the acidic environment of the stomach, so it will not come back up, hopefully. Anyway, that's a powder, concentrate. They do not make concentrate, and then ready to feed. And lastly, Similac Total Comfort. Milk protein there is available as a whey protein hydrolysate, so partially broken down, but not to the extent needed for a milk protein allergy. And it is also lactose reduced, just like the other two formulas. And this is available in powder and ready to feed versions. Okay, so exempt infant formulas are ones that are designed for special medical conditions, and WiC pays the retail price for. So WiC is not getting any cost containment contract in there. So we don't have as many stipulations about what brand it has to be or anything like that. Just as before, they have to be prescribed by a healthcare provider on either our Maryland WiC medical documentation form, or we can take it on a prescription note if it has all the required information for a specific qualifying medical condition. And they're always subject to our CPA or nutritionist approval. Okay, now here is a list of some of the examples of Maryland WIC authorized exempt infant formulas. This is not exclusive of all the of all the formulas that we provide or authorized, and they might not be authorized for every condition. They're always subject to the local agency nutritionist approval. But here you can see a list of some of those. We have elemental formulas here, some of your premature infant formulas, casein hydrolysates, and for other specific conditions. Okay. And a note about when we issue formula to any infant that's being breastfed, they are issued the amount that they need. We do not provide them more just in case, because we want to encourage breastfeeding as much as possible. And research has shown again and again, the more formula that a mom is provided, the more likely she is to increase the amount of formula she is given. So we provide the amount that meets and most closely matches the volume consumed up to the maximum we can provide. And you saw some of the, that it was mentioned several times that we only provide ready-to-feed formula in certain circumstances. We can provide it for, it's up to the determination of the CPA or the WIC nutritionist, but also sometimes some agencies will require that be listed on the medical documentation form if it is also a specialty formula. So we can provide it when it's the only form available. If there is an unsafe or restricted water supply, when Flint, Michigan had the issues with lead in its water, I believe it still is, but not in the news as much, WIC was allowed to provide ready-to-feed formula to infants in that area since they did not have safe water. Also, or if it's restricted, we had an incident in Maryland recently where a municipality's water source was contaminated with a type of bacteria. So we were able to issue ready-to-feed formula to participants in that area that have that water source. Obviously, poor refrigeration. If a participant is homeless, living in a shelter, moving around, kind of transient, we can provide formula in the ready-to-feed form. And also, if we're concerned that the caregiver is not mixing it correctly or not understanding the proper dilution, we hate to come across this after the fact if we get a call from a social worker saying this child was on WIC or they ended up in the hospital failing to thrive because they weren't mixing the formula correctly. They didn't understand. So we try to go on the side of caution on that, but that is definitely a reason we can provide ready-to-feed formula if we're concerned that the parent or caregiver cannot mix the formula correctly. Okay, so qualifying conditions. I've said this several times that we can only issue infant formulas for qualifying conditions. And pretty much what it's saying here is that they have to be an actual medical type condition that requires special nutritional needs. It can't be something general. But here it has listed some of them, and not all of these conditions are going to be appropriate for every single type of formula. For example, you might not want certain inborn errors of metabolism won't warrant a formula that has a component in it that they cannot digest. Or if someone has a milk protein allergy, you do not want to provide a formula that has milk protein in it, even though it might be lactose reduced. So this gives you a list of some of the general categories of qualifying conditions. However, there is also some very specific non-qualifying conditions that the federal regulations spell out for us. This is right from the CFR that I talked about earlier. And this is in the Food Package 3, which again is where we issue the specialty formulas. A diagnosed formula intolerance or food allergy to lactose, sucrose, milk protein, or soy protein that does not require the use of an exempt infant formula. So for example, if a baby was found to be allergic to a milk protein, but they could do a soy formula, they wouldn't necessarily require the use of an exempt infant formula. Nonspecific formula or food intolerance, and nonspecific symptoms or conditions such as intolerance, constipation, gas, fussiness, colic, or spit up. And we do have this information right on the medical documentation form. Okay, so as I mentioned, medical documentation forms are required to issue any infant formula other than the contract formulas, including the special issue contract, exempt infant formulas, non-contract infant formulas in the rare case that they're required, or WiC eligible nutritionals. Okay, so this is our medical documentation form. It was recently just updated and it is available on our website. There is 4 required sections. The patient information, and then the exempt infant formula, WiC eligible nutritional requests, the WiC food requests, and provider information. Okay, just at the beginning, the very top of the medical documentation form, we have a field that's used for WiC clinic use, some information on also the state WiC office's number to call if you have any questions, or refers you to the back of the form to call your local WiC clinic. It also always lists the special, the contract formulas. Okay, so the first part is really just for identification purposes, patient name and date of birth. Parent or guardian is not required, but it is helpful if the child is in foster or kinship care. And then we have participant medical data. That is, again, not required, but very much appreciated. It helps us for kind of weight-related diagnoses like failure to thrive. And we can plot that on our WiC growth chart along with weights and heights that we have taken in clinic. Also, if the hemoglobin or hematocrit is provided, can save the child a finger prick in clinic, which they very much appreciate. Okay, so probably one of the most important sections here is section 2, which the first part requests the medical diagnosis and the symptoms. And the medical diagnosis is a specific qualifying medical diagnosis, so something that falls under the umbrella of the ones that I listed previously that warrants the need for a specific formula. We can't take ICD codes, we need to have it actually written out. So to give you an example of a specific diagnosis, that could be something like GERD, but not something more general like GI disorder. Because both of those, obviously, some GI disorders could require, you know, a formula that's elemental or that has the fat broken down into MCT oil. A medical diagnosis should be something like Hirschsprung's disease, not constipation, because under the federal regs, constipation is considered a non-specific symptom. Optional, but strongly encouraged and appreciated is symptoms. The more detail, the better. So if it's symptomatic of, and not all cases would this necessarily apply, but if it was something like a milk protein allergy, the symptoms could be, you know, if they're having bloody diarrhea or something, that kind of stuff helps with the CPA approval process. And to give you an example, I've gotten actually phone calls on this before, but there was an infant who was experiencing symptoms indicative of a milk protein allergy. So they were having diarrhea, blood in the stools, and this resolved with a trial of a Casein hydrolysate formula, so where the protein was broken down. And further investigation to test for a milk protein allergy was unnecessary. The symptoms had resolved. So the healthcare provider was hesitant to write the diagnosis of a milk protein allergy on the form without the definitive testing. So they write milk intolerance because they really had no proof or definitive answer that this was definitely a milk protein allergy. Now, if this medical diagnosis of milk intolerance was faxed to a local agency, likely this would have been denied, but the symptoms was less blank. So as is, this wouldn't have qualified to issue a special formula. However, if the symptoms would have been on there, so the healthcare providers understood they didn't want to diagnose with a milk protein allergy without knowing more definitively. They put milk intolerance, but they also included the symptoms of diarrhea and bloody stool, which are, hallmark signs of a milk protein allergy or a suspected milk protein allergy. The local agency could have accepted that for a specialty formula, a casein hydrolysate formula. So this could have made a difference between a yes or a no, or also the back and forth between the offices of the faxing of forms. Okay. So the next part, of course, pretty obvious, the product part. But being specific is important. For example, if you wanted EleCare Infant instead of EleCare Junior versus just putting EleCare, because they are different products in terms of calorie levels. And duration, the longest a request may be approved is for 12 months. The CPA can approve it for a shorter duration than requested, and different agencies deal with that differently. Optional, but strongly encouraged. We did add a calorie level box. If it's unchecked or otherwise specified, the standard dilution is assumed. So calorie level is needed if anything other than the standard dilution is requested. So if you're providing, let's say you wanted to give NeoSure, which is usually 22 calories per ounce, but you really wanted it for 24, that's where you could put calorie level other 24. Otherwise, we would assume 22. An amount per day. For an infant, the maximum allowed is provided unless they are breastfed or otherwise specified. Okay, so this is an example where if NeoSure, which is a premature formula, was issued, we would assume the standard dilution at 22 calories an ounce, and we would provide the WiC maximum for 3 months or less. Okay, so section 3 is often the most neglected section, and sometimes it's understandable because if an infant is only a month old, why would we be looking at the foods that they're providing? Well, often these forms will cover until they are 7 months or 8 months, and the WiC program starts giving food at 6 months of age. So in order for that participant, that infant participant, to be able to get baby food starting at 6 months, we need the authorization to be able to provide it. So if you're writing this medical documentation form for an infant that's 2 months and you write it for 6, we do need this section to be filled out to give baby food. Now, if WiC, the first one up here, WiC Professional may determine WiC foods and amounts. This allows the WiC person, the WiC nutritionist, to determine what is the appropriate food package for the participant. Otherwise, they are limited to what is checked off. Now, for an infant, this is a lot more straightforward, but you can see there's a lot more options here, like whole milk for a woman or a child, issuing infant fruits or vegetables to a woman or a child, or do not issue, comment would be required. So in this example, let's say this request was for Pediasure for a 3-year-old child with failure to thrive, and no food restrictions was checked off. The WiC Professional would have to issue the standard package for the age group, which would mean 1% or fat-free milk. To issue the whole milk, WiC would have had to get authorization from the healthcare provider. So they would have to get this form faxed back to either have the milk box checked off, or, which is whole milk for a woman or a child, or alternatively, if WiC Professional may determine was checked off, the WiC CPA would be able to make the determination that whole milk could be issued in place of 1% or fat-free milk. So in instances where you're comfortable with the WiC Professional making those determinations, this gives the CPA or the nutritionist a lot more flexibility in being able to make setting up whole milks are more appropriate, if foods are appropriate at 6 months, etc. Okay, and then this part is usually pretty straightforward, but making sure that the provider, we have your signature and then also your credentials, MD, DO, etc. Okay, so there's also summarizing the required information that we need, and this is also, again, in our policy in this chart form. And then the optional information, the participant medical data, and the symptoms. Okay. So this is, again, to emphasize that these are always up to the discretion of the local agency CPA. And I'm going to show you quickly, which will be posted on our website, some of the formulas that WiC may provide and the calorie levels. So you're aware of the standard dilutions. And this has, for example, you can see EleCare for infants is 20 calories per ounce, where the EleCare Junior is 30 calories an ounce. So this gives you an idea if you're okay with the standard dilution. And then, of course, we're not wanting ready-to-feed formulas to be diluted, so this gives you the calorie levels as is for these different products. Okay. And the main point here is I've mentioned several times that most WiC participants end up having to buy formula on their own. And this gives you an idea of the maximum amount of formula that we can provide. And you can see this is the amount of ounces per month that we can issue. And this actually varies in terms of ounces per day. If you look here, this is the powdered formula that we can provide. And reconstituted, this is 870 to 960 depending on age. And then when they're getting foods, 696. Well, this ranges from about 23 to 32 ounces per day. And based on sometimes the requests that we get, infants are consuming a lot more ounces of formula than the max that WiC can provide. And to give an idea, again, 21 to 32 ounces based on the age of the infant and reconstitution rate of the formula they are using. And in the interest of time, through the calculations, because I gotta catch up here. But to go, these are some of the exempt infant formulas that we can provide. There's some premature ones, and this goes over the types. The high-calorie, ready-to-feed, full-term formulas, such as Similac with iron and Infant Milk 24. Our hypoallergenic formulas, such as Nutramigen, Alimentum, Gerber Extensive HA, and Progestamil. Again, these will be posted, so you'll have access to that. And then your elemental formulas. Alpha-Amino Infant, EleCare, Neocate, Pure Amino Infant. Okay. And there's several reasons why our guidelines are very strict on these part is we want to make sure, again, WiC does not provide all the formula an infant needs, and most participants need to buy some on their own. So we want to make sure they really need it. If they really need it, of course, we want to provide it. But we want to make sure that there might be a lifestyle change that they can make. For example, if they're having trouble with GERD or reflux, and sometimes we'll have a 2-week-old baby that's already getting 8-ounce bottles. So that might be solved versus going to a more expensive casein hydrolysate formulas. So we do try to troubleshoot and see, is this what mom's experiencing? Is this normal baby behavior, or is it something to be concerned about? So just a food for thought. So WiC-eligible nutritionals are more or less the WiC medical foods, and this has a definition, the federal definition for those. And we can provide, there's many, many, many products. This is just a small list of those. It has your elemental, it has some of your toddler formulas, as well as some more specialty products as well. We haven't listed here, but we also can provide metabolic products too. That would make this list extremely long, but we can with the appropriate diagnosis and medical documentation. Okay, so similarly, the same qualifying conditions that cover infants are also applied to women and children. They have to be one of these to be issued a specialty product to a woman or a child. And then there's the non-qualifying ones. Again, not a non-specific intolerance, food intolerance to lactose or milk protein that can be successfully managed with the use of other WiC foods. For example, if they have a lactose intolerance, we can provide lactose reduced or free milk, or we can provide a soy beverage if they have a milk protein allergy, or someone enhancing nutrient intake or managing body weight. So we can't be providing like a diet drink like Slim Fast or something like that. Okay. Okay, and the maximum amount that we can give to a woman or child for their medical food is 910 fluid ounces per month, which is about 30 ounces per day. Now this, we tend not to give the maximum for this and aren't required to, because oftentimes they're getting all their other WiC foods, and this is a supplement to their WiC foods, unless otherwise in the case that maybe they can't eat quite a few of those. But for example, a 1-year-old that is, there's a request for Pediasure, and providing this would be probably 3 to 4 Pediasure a day for a 1-year-old is they wouldn't be eating any of their WiC foods if they were getting that amount. So we would probably, if warranted, provide 1. And this gives you an idea of some of the different calorie levels for WiC foods. I'm sorry, the WiC formulas. Okay, and some of the ones that I mentioned that we can provide, toddler formulas, we do issue these in more rare circumstances because most infants can transition as a child to whole milk or soy milk. Many different WiC eligible nutritionals available out there as well. And then there's specific ones for women, and these tend not to be issued as much as they are or requested as much as for children. And then we also have the elemental formulas for children as well. Okay, and then we do have some other options that I've mentioned, having whole milk in place of 1% or fat-free. We can do 2% milk for a 1-year-old, soy or tofu for women or children in place of milk and cheese. And for some children that need baby foods past the age of 1, developmental delayed or premature, we can provide that in place of their fruit and vegetable check with documentation. Okay. And lastly, as promised, to talk quickly about the Zika virus, especially with the Olympics, I guess starting on Friday, I believe, is opening ceremonies. This has been in the news quite often, and so just some basic information from DHMH on the Zika virus. Okay. So pretty much it is usually for most people, if they get any symptoms, it's extremely mild, but the problem is, of course, if someone receives, if they are infected with the virus during pregnancy, they can have a baby born with serious birth defects, the microcephaly, which can be debilitating for the rest of the infant's life. It's usually spread through the bite of an infected mosquito, but it can also be sexually transmitted, which is a unique part of this virus. For now, all Zika cases in Maryland have been related to travel and sexual transmission. There has been no local transmission from Maryland mosquitoes. I think there was the first local infection in terms of in the U.S., continental U.S., in Florida recently this week. And this just says the type of mosquitoes breed in containers of water of all sizes, so making sure you don't have standing water sitting around. Do your best to avoid mosquito bites, using insect repellent, wearing lightweight pants, and then also some information on where to go to get help. Okay, and this is the friendly little mosquito that's sharing this virus, and it's a picture of that. And again, this is the type of mosquito that's in standing water. Okay, and for more information, you can visit the DHMH Town Hall. You can watch the video. There's also updates frequently on these websites. Okay. And wanted to do a thank you real quick to the Healthcare Provider Webinar Work Group, Jennifer Barr, Donna Dennis, Mary Coucher, and Shannon Meadows, all dietitians with the Maryland WiC program or local agencies. And also as a thank you for attending, looks like there has been no questions entering in. and we're about done with our time. There will be a survey sent out to attendees of this webinar. This will also be recorded and posted on our website for viewing, and the slides will be posted as well. So feel free to direct any questions to our 1-800 number. Also can be emailed at dhmh.wic@maryland.gov. And please fill out the survey when we get it so we can get feedback and ideas for further webinars. Thank you.